Alrighty. Many thanks for tuning in to Joy 99.7 FM. Time for Ultimate Health, your ultimate guide to healthy living. This is Sunday 2:05. With none other by myself, Nortey by nature. A bit late, a bit down. Lost a very good and precious friend. Like they say, the good Lord knows best. Let me take this one, knowing she'll get eternal rest. This is by Eternal. It's called Wanna Be the Only One.
Joy 99.
Chance. It's called 99.7 FM. Many thanks to our loyal listeners. Met a couple of you last Saturday, right? Linda and your husband in Osu. The artist Lariotu. I think I met a Mauto. The names are many. Thanks for making us the only dial. I'm trying to pick myself up. Ultimate Health on Joy 99.7 FM. Since the 14th, or a little before the 14th of November, we've been focusing on knowing your risk, knowing your response. Yes, we've locked it down on diabetes. Today we try to wrap up and give Dr. Chris Aday a well-deserved rest, but not before we tackle chronic complications of diabetes. We've looked at the types, we've looked at the causes, we've gotten to understand some of the different scenarios that arise, how it's diagnosed and all that. And he's back, believe it or not, today to share with us some of the advanced downstream, more chronic complications of diabetes. So if you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. Ultimate Health on Joy 99.7 FM. Doc, good afternoon.
Good afternoon, Nortey.
Good to see you.
Good to see you too.
Yeah. I'm a bit under the cloud kind of. I lost a very good friend to cancer. It's been tough.
My condolences.
But God knows best.
Sure.
Right, so let's do the do and have fun whilst we get it done, as I like to say on Ultimate Health. We've done almost the full Monty, the full 360, but we wanted today to focus on chronic complications. We spoke of the acute complications. But let's start by educating our listeners. When we say acute and chronic, right? What do we really mean? What's the distinction?
Okay, so in medicine, when we say acute, we simply means that it's of a short duration.
Okay.
So it is just with respect to time.
Okay.
So acute means of a short duration.
Duration.
Yes. And then when we say chronic, we are talking about the long term.
Something that's going to be there for quite a while.
A very long time.
Okay.
Or it will take a long time to develop.
So you can have an acute complication,
yes,
which is serious.
Yes.
So we're only talking about duration here.
Yes.
Not the intensity or the severity of the complication.
Exactly. I know in normal parlance, when we say acute, we think, oh, it's something severe. When we say like acute water shortage, and then we are talking about something very, very intense.
Right.
But acute simply means it's of a short duration. It usually may be very severe, but that is not what the focus is.
So that means if we say something is acute, we expect its natural, normal course to be very limited, short.
Exactly.
In time.
Exactly. Okay. Like malaria. We say malaria is an acute illness.
Okay.
Because, the treatment is even for just 3 days and you are done. But we say that diabetes is a chronic condition.
Right.
So you live with it for a very long time. So you take medications or whatever interventions we put forward over the long time.
Right.
Yes. So that's exactly what it means.
So
it doesn't mean chronic cannot be severe. In fact, chronic conditions in diabetes are usually very severe and can lead to fatalities.
Right. Okay. Yes. We're trying to make sure we are clear.
Yes.
Understood rather than misunderstood. Okay. So acute in terms of short duration. And if you were, as a clinician, handling an acute complication, you're expecting it to what? To resolve very quickly and respond to your treatment.
Exactly.
Okay.
Exactly. So like we said the last time, we talked about the 3 complications, acute complications of diabetes, where I talked about hypoglycemia, where your blood sugar is very low. We can quickly correct that one and then we end the story.
Okay.
Same with the DK and the HHS that I talked about.
Wait. Slow down. Okay. We're still digesting acute and chronic. So DK, let's just go through.
Yes, the reason I just don't want to go into the details because we talked about it.
No, let's say what they are.
Yes, so the DK was diabetic ketoacidosis.
Okay.
Which I said is one of the complications of diabetes where your sugar goes very, very, very high.
Okay.
Which is a very serious condition. We need to manage you in hospital.
Okay.
And its sister or cousin is the HHS.
Okay.
So those are acute complications. We manage in the hospital, short duration, and we can get on top of it.
Okay.
But what we are talking about are the chronic complications that don't fit in that. Okay.
Still with revision. When we said very, very high, I remember you and what have I forgotten her name?
Dr. Baye.
Baye, right?
Yes.
Okay. Beatrice, right?
Yes.
Beatrice. Yeah. Doc Beatrice, right? We gave a cutoff, right? We're talking about 11 plus. Or what was it for that?
So that was the definition.
The definition.
Yes, but regarding the complications, normally the low sugar is less than 4. And then when we talk about the high sugars, like I said, the DK and the HHS, about 14 generally.
Right.
Yes.
Joy 99.7 FM.
Okay, that gets us some clarity, so that you know where we are, because I know you're listening. You're typing 055 11 11 997. That's the WhatsApp number. We're live on Facebook and YouTube, so that you join us at the right point. We don't mind going back, but we try to make sure we take the whole class along, the whole family. I'm in the studio with Dr. Chris Ade. He's a senior physician specialist with the Trust Hospitals here in Accra. He's also a senior endocrinology resident at the Kolebu Teaching Hospital, and diabetes falls right on his laps, all right? And he's getting better and better and better and deeper in knowledge about this condition and its management. Any questions, concerns, experiences, doubts are welcome. 055 11 11 997. Okay, so let's come to the chronic complications. So these are complications arising out of diabetes, which is the elevated blood sugar.
Yes.
Right?
Over a long period.
Over a long period. Okay. So what are these, or what are some of these, and can we break them down for the benefit of our listeners, Doc?
Okay. So I would like to adopt this simple approach.
Okay.
we'll talk about the complications that mainly affect the small vessels. Okay. Small vessels of the body.
Okay.
And then we'll talk about the ones that affect the large vessels of the body.
Okay.
Some of them are a combination of both.
Okay.
And then a few others may not fall neatly into this.
When you say vessels, you're referring to blood vessels.
Blood vessels.
Okay.
Yes.
Because we're talking about a situation that affects the concentration or the levels of glucose
in the blood.
Yes. And the blood goes everywhere.
Yes. Through the vessels.
So from what you just said, there are smaller vessels, microvascular.
Yes.
Okay, the people read all these things and they get frightened, right? So microvascular is small vessel, and we're going to look at complications related to or ensuing from damage or problems with these smaller vessels.
Yes.
Okay, good. We're good to go, teacher.
All right.
Right.
So the first one is what we call diabetic neuropathy, or simply nerve damage.
Nerve damage.
Neuropathy is just nerve damage.
Okay.
Then we have the diabetic retinopathy or diabetic eye disease.
Okay.
So this affects the small vessels within the lining, which is at the back of the eye. Okay.
Mm-hmm.
Which can ultimately lead to blindness.
Okay.
Then we'll talk about diabetic nephropathy or diabetic kidney disease.
Okay.
Joy,
so this is what leads
FM.
ultimately to the end-stage kidney failure that would require dialysis or a kidney transplant to survive.
Okay.
Yes. So these are the three main conditions that affect the small vessels. So we call them microvascular complications. Micro is just small, and then vascular is vessels.
Okay, Doc, help me please. So when you say neuropathy, retinopathy, and nephropathy,
yes,
which is to do with the
kidneys.
So these are nerve diseases, eye diseases, and kidney diseases, secondary or caused by
diabetes. Long-standing, usually poorly controlled diabetes.
Okay.
Yes.
Understanding being that we can have kidney disease with other antecedents or causes.
Exactly.
You can have renal disease or nephrotic disease or whatever, right? Caused by other factors.
Exactly. Thank you, Nortey, for clarifying that. When we say kidney disease, it's actually a large basket. Okay. So many conditions can lead ultimately to kidney disease.
Okay.
And diabetes is only one of them.
Right.
Hypertension, infections, abuse of medications, alcohol, smoking, poor diets, a host of other factors can lead to kidney disease.
Right.
But we are saying that our focus is diabetes for now.
Okay.
And when diabetes is poorly controlled, ultimately it can lead to kidney disease.
Okay, and eye disease.
Yes.
And the
and
nerve disease.
Damage.
Okay, but Doc, share with me. So that means that sometimes, just like inflation, where we can look at the key drivers of inflation, what is causing inflation, right? Or we can look at damage to the environment, and we look at what is damaging the environment.
Exactly.
So it is possible, and maybe you'll be able to share with me the degree. It is possible that when we hear high numbers or statistics with regard to kidney and other conditions, they could largely be fueled by diabetes.
Absolutely. In fact, if you go to Kolebu or any of the other centers where we do dialysis for end-stage kidney disease patients,
right,
for every 10 patients who are on dialysis, about 7 or 8 of them are there because of diabetes and hypertension.
Wow.
In fact, all over the world, diabetes alone causes about half of all patients on dialysis.
Wow.
It causes kidney failure in half of the patients on dialysis.
Okay.
In Ghana, hypertension trumps diabetes.
Okay.
But when you put the two together, about 8 out of 10, it's because of diabetes and hypertension.
And we know that, what was the trinity we're talking about now? The unholy trinity.
The unholy trinity.
Is...
Yes, so we talk about diabetes, high blood pressure, and high blood cholesterol.
Right. Okay. So as you listen to us, it's 20 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday with me, Nortey by nature. I'm in the company of Dr. Chris Adair, who's been schooling us since the middle of November on diabetes. So today we're focusing on chronic complications of diabetes. The important thing to know is that all the treatment and other modalities we've handled or discussed earlier are designed to prevent the development, the progression of the disease to these chronic complications. Indeed, to avoid, if not prevent, these complications developing. So, the reason I'm saying this is that if you are on any management, or if you are not even diabetic, whatever you're doing that is keeping you away from this condition needs to be well coordinated and managed and complied with. Otherwise, the menu we have for today is something you could be contending with, right? So this is very important. Your doctors, your clinicians, all the measures, be they lifestyle or other things, are really managing your blood sugar or your diabetes such that you do not arrive at this destination. This is not a bus stop you want to get off on. All right. Any questions, concerns? WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. This is Ultimate Health on Joy 99.7 FM. We're discussing chronic diabetic complications with Dr. Chris Adair. Right. So, Doc.
Joy 99.7
Understood.
FM.
So, can we take them one by one? Neuropathy, diabetic neuropathy. What's that? Okay. We hear nerves, but it doesn't sit too well. We hear it and we feel it's to do with feelings. Sometimes people say, when you have pins and needles or anansi, it is nerves. When you say nerve disease or diabetic neuropathy, what are you talking about?
Okay, so let me see if I can break it down. When we look at the nerves, I like to do this analogy with the power station in Akosombo, the hydroelectric dam.
Okay.
So the control room, the power station in Akosombo, let's take it like your brain.
Okay.
That's where all the control comes from.
Okay.
Okay. Then from the brain, you move to the spinal cord.
That's right.
So I liken the spinal cord to the transmission lines, the cables.
Okay.
That's take electricity from Akosombo to the various towns and villages.
Handled by Gridco.
Exactly.
Okay.
And then the nerves would be equivalent to the electric lines that come from the poles to the house.
Okay.
Okay. Because that's where the final delivery of the power will take place.
Okay.
So the nerves are this final, relay.
Okay.
So to be able to move your hands, your legs, all the activities that you are able to do, is the brain that sends impulses through the spinal cord to the nerves for you to be able to do all the things that you do.
Right.
So when you have poorly controlled diabetes, the high blood sugar is actually poisonous to these nerves.
Okay.
It damages the nerves. And when these nerves are damaged, that is when you see all the effects, the symptoms that you talked about, like pins and needles sensation, tingling sensation. Some of them will tell you it's as if I'm walking on foam, it's as if I'm walking in water.
Okay.
When I sleep in the night and the blanket covers my legs, I feel pain.
Okay.
All manner of things.
Right.
It is because there is damage to the nerves.
Okay.
And what makes us so worried about this is that your ability to sense pain sensation may be compromised.
Okay.
And therefore you see people stepping on nails and they don't feel it. You examine a patient's feet, there may be nails in them and they do not feel it because the nerves have been damaged. And that is what is putting your foot at risk for amputation.
Right. So
that is why we worry about these things.
In the normal scenario, if you step on something, if there's heat or anything around any part of your body, you should sense and perceive this
and withdraw.
Right.
Yes, it's a protective mechanism.
Right.
Some people put their feet in hot water and they get burnt because they cannot sense
how hot
it is. Yes. And so we even advise our patients not to test the hotness of the water with your feet.
Right.
Yes.
So diabetic neuropathy has to do with problems with sensation.
Yes.
Okay. So I can understand the feet and other things. Are there any other telltale signs that my listeners could identify with?
In fact, the feet are the typical ones, but it can affect all nerves in the body.
Okay.
And what the men worry about the most, the dumso, the erectile dysfunction, is also because of damage to the nerves that supply the genitalia.
All right.
So the neuropathy can also manifest in male impotence by damaging the nerve supply to the genitals.
And folks, do remember the distinction. Impotence is the power. He's talking about dumso.
Yes.
Right? So erectile dysfunction, secondary or caused by diabetes.
Yes.
Right? Related to diabetes. He's not talked about infertility.
Yes.
Okay? We're talking power issues here. So let's be clear. So okay, that's the men. Is there an equivalent in women?
Well, there's something called female sexual arousal disorder.
Okay.
So that can also occur in the women, and that would be a sort of equivalent.
Okay. I'm just looking to educate and inform.
I agree.
I'm not looking to equalize. Right? Okay, so we are understanding this.
Yes.
So erectile dysfunction, inability to feel and perceive pain, pressure, and so on at different points of the body.
Yes.
Okay. So essentially we're saying the high blood sugar or blood glucose has damaged these nerves at these different points.
Yes.
And so this is something serious.
It is serious.
Okay.
It is serious. So in fact, most of the times when we talk about management of diabetes, all the things that we do on a daily basis is to prevent these things.
Okay.
Because by and large, like I keep on saying, diabetes is asymptomatic.
Right.
You know, it doesn't cause a lot of symptoms.
Silent.
It's silent.
But
so
deadly.
You hear people, that's why we call it a silent killer.
Right.
You know, that's why you hear people sometimes say, if I don't take my medicine, I don't feel any worse.
I'm fine.
And if I take it, I don't feel any better. So, I mean, sometimes I take it, sometimes I don't take it. You know, it is because of these chronic complications. That's why your healthcare professionals may seem to be hard on you, because we are looking into the future. What may happen in the next 5, 10, 15, 20 years.
Right. Okay. 28 minutes past the hour of 2 on Joy 99.7 FM. This one says, this is from Joyce Daintu Kurtzman of Prudential Securities, I believe. My mom is diabetic and the foot is becoming dark and the legs look cracked and dry. What should we do? Okay, it says Nanaifua. Right. Any response to that, Doc?
Okay, so we're going to come back to the large vessel diseases.
Okay.
And then it would help also answer this.
Okay.
Okay, one of the complications that affects the large vessels is what we call peripheral arterial disease.
Okay.
Okay, commonly affecting the lower limbs.
Okay.
And usually it goes together with the nerve damage to cause problems like this.
Okay.
That Nana Ifwa is referring to.
Okay.
So when you damage the large vessels to the lower limbs, and then you also damage the nerves, then you create a very conducive environment for ulcers to take place.
Ulcers, infections. Right.
You know, and then ultimately gangrene, which is dead tissue.
Dead tissue.
You know, and then
the tissue is rotting.
Exactly. And then we may have to amputate to save your life.
Okay.
So when you begin to see darkening of the lower limbs, it could be a sign that the blood vessel or the blood supply is compromised.
Right.
And you need to report to your healthcare professional.
Okay.
We can investigate.
Right.
And there is treatment before we get to the ulcer and the amputation.
Right.
So,
Doc, would it be the case, right,
yes,
that when people hear this kind of information and education and they are actually experiencing or manifesting darkening of the skin and some of the things we're talking about, they may tend to be reluctant? I'm bringing in the physical and the psychological, right? The interpretation is that if I listen to Nortey and Doc and I go and see them, they are going to take out a hacksaw or something, and eventually I may get to the point of amputation. So there may be a reticence or a reluctance to report some of these symptoms.
Okay. On the contrary, the reason we are even doing this is for you to pick up these things early and report so that we can intervene.
Okay.
We can always step in to stop the process at an early stage.
Okay.
It's just like the Pink October,
right,
the breast cancer.
Right.
When we pick the lump early,
okay,
we take it out and then we prevent you from developing the full-blown cancer that will spread.
Okay.
Same with the prostate issues for the Blue November.
Okay.
So don't be scared.
Right.
The reason we are discussing these things, we can stop the process or reverse it or intervene at this stage.
Okay.
If it gets to the stage where it becomes dead tissue, we can't bring it back to life.
Okie dokie. Right. So essentially, just like with breast cancer awareness, sharing these symptoms and signs and indications also encourages you to do self-examination.
Yeah.
Right? Have a look at your extremities, your lower limbs and all these things. Have you lost sensation? Are you unable to feel certain things and so on and so forth? Is there darkening or, a pitting of the skin there and so on and so forth?
Or
and
is
report
it getting cold?
Is it cold?
Yes.
Okay. Right. Doc, let me ask. We're still locked on the neuropathy. I'm sure we need to move faster. But let me ask. So when I start to perceive or see these things manifest, am I past the stage of lifestyle modifications? So somebody's thinking, well, they asked me to exercise and do this, but if these things have started, say I am too late.
No.
Or they still go hand in hand.
Yes, they still go hand in hand.
Okay.
The most ideal thing is to prevent something.
Okay.
But if you can't prevent it, at least diagnose it in the early stage.
Okay.
Don't allow it to get to an advanced stage.
Okay.
Where the options for intervention are limited.
And then they make people like you so qualified.
Yeah.
Redundant.
Exactly.
Essentially. All right, great stuff. On my WhatsApp, this says, good afternoon. Wow, I love this power station example the doctor is giving. Yes, we brought it down to gridco and current affairs, even politics, inflation and all that. That's what we do every Sunday, 2:05 on Ultimate Health. It simplified the situation and makes me appreciate the whole situation. This is from Hope in Odumase, Krobo. We're glad we've not only informed you, Hope, but we've transformed you. Dede in Maryland is asking if this t-shirt I'm wearing is for her. Dede, we will fit. The two of us can go. Okay, I haven't seen you in a while. Can fit into this t-shirt, but I'll do my best to get you one. Right? Thank you. You are a very, very loyal and discerning listener. Good afternoon, Joy FM. I want to crave your indulgence. Okay, Abeku, my thing is delaying. Can you scroll down for me, Abeku? Okay, it's going slowly. Hey. Small transmission we talked about, now things are dragging. Come on. Abek, okay, scroll that down for me and let me see. It seems to be fighting with my mouse here. All right, but somebody's asking a question. You can ask yours. WhatsApp is 055 11 11 997. Good afternoon, Joy. Please, I want to create or crave your indulgence. If a person has given birth, had 3 children, all with cesarean, and after all that, during the last birth, her one tube was blocked and causing pains in years' time because... Okay, I don't get this. It has your number. I'll get back to you and then try and see if I can do sidebar with you. This is about pregnancy and cesarean and all that. Okay, we're talking about chronic complications of diabetes. Okay, so Doc, are we done? Is there anything about the neuropathy we need to understand further?
Oh, I mean, I want us to go through all of them quickly. So I think for now.
So the next one was diabetic retinopathy.
Yes.
Right? Pathy means there's something wrong.
Yes.
Something pathological.
Yes.
Retina is the eye.
The back. There's a lining at the back of the eye, which allows you to see things.
All right.
Yes, so
on the screen. Wow.
Yes, I had to say screen. You know
screen.
Those times when we had the pinhole camera, that black thin lining.
Yeah, man.
Yes, so that it captures the image.
The pinhole that takes a picture, but then they'll use pencil to do your eyebrows. Okay, Doc. We appreciate the analogy. So diabetic retinopathy.
Yes. So sometimes I really don't even want us to focus so much on the terminology. So maybe for that one, we can also say diabetic eye disease.
Okay.
So for those who like the retinopathy, that is fine. But it's simply diabetic eye disease.
So when I have diabetes,
yes,
and it progresses and manifests as eye disease,
yes,
what will I notice? Okay. These days we are pushing our phone back, we are adjusting the font size, we're doing all sorts of things. Okay. What are the signs and symptoms that would indicate?
Okay, even before the signs and symptoms, like I keep on saying, the whole focus is to prevent them.
To prevent.
Okay. So I would encourage that if you have diabetes, at least once a year, you should see the eye doctor. Because we like to do screening to pick up the condition even before you start manifesting symptoms.
Okay.
That's the whole idea. Even the diabetic foot disease, the peripheral neuropathy I was talking about, we would like you to examine your feet. We'd like you to let your doctor examine your feet when you go for visits at least once a year.
Right.
So that if you begin to lose sensation, we should pick it early and not wait for the nail to be stuck in there for you not to be able to feel it.
Okay.
You know, we don't want to get there. But if you are gone past where we picked it, then we can talk about the symptoms. So in the case of the eye disease, for instance, you may have floaters, you know, as if there are objects floating in your field of vision. Okay, your vision may become blurred.
Right.
You know, and if all this continues without you seeking intervention, ultimately it may lead to blindness.
Okay. So let me put together some kind of case scenario. So I'm experiencing some of these things, but I've gone to the ophthalmologist, or I went to the opticians. I want glasses, spectacles, right? They examine me and do all those things, read this one from far away, do this, that. Is it possible that somebody could find out through ophthalmological examination or a visit to the opticians that there could be something wrong with your eyes that may be linked or related to diabetes?
You're absolutely right. In fact, there are times when I get referral from the ophthalmologist. Because the ophthalmologist has seen certain changes in the eye. And it's suggestive of diabetic eye disease. So they refer you to the physicians for the diagnosis to be made. So sometimes that is the first sign that you have diabetes. You are already coming down with a complication even before the diagnosis is made.
They will still get you the specs or whatever corrective lenses you need, but they will make this required referral.
Definitely. Definitely.
So that you get the underlying causative disease or condition checked.
Exactly. In fact, most people worry about refractive errors, but even that is not really a disease per se. So wearing spectacles for short-sightedness or long-sightedness is really not a big deal. It is the damage to the blinding of the eyes which can lead to the blindness that we are concerned about.
You're hearing us live on Joy 99.7 FM Ultimate Health, your ultimate guide to healthy living. Today we're focusing on chronic diabetic complications and how you can pick them up and what your response should be. Remember, the theme for this year was know your risk, know your response. So Chris and I are tying the two together, and we're looking at appropriate responses, not the wayo ones that cause more problem and hassle. If you have any questions, concerns, let me activate the phone lines now. Abeku 030-221-6541. 030-221-6541. We're live on Facebook and YouTube, and the phone line is active now. We're talking with senior physician specialist and senior endocrinology resident Dr. Chris Adai. He can be located in the same grid, but you can catch him at the Trust Hospital substation. So our phone line is active 030-221-6541. Ultimate Health on Joy 99.7 FM. So it can damage the eye, and this damage, especially if the blood sugar and its control are not effective, is progressive.
Yes.
So you ultimately would lose your sight
without intervention. And that is why I keep on stressing that you should see the appropriate specialist. You see, diabetes is managed not only by the endocrinologist or physician. All specialties manage diabetes because it's a multi-system disease.
Everybody must know about it.
Everybody does, and every practice is impacted, whether you are a surgeon or an ophthalmologist or a dentist. In fact, we don't even talk about that enough, but diabetes can also affect the gum and the teeth. So once a year at least, you should also see the dentist. So
wherever you're seeing somebody, you should actually disclose this history.
Exactly.
And they need to know.
Exactly. So I tell my patients, when you go and see your dentist or your ophthalmologist, tell them that you have diabetes. They know what to look for. When you have the condition.
Don't hide it. Win that battle of disclosure. I have somebody on the line. Hello, good afternoon.
Good afternoon.
Good afternoon, sir. Your name and where you're calling us from?
I'm Kweku calling from Ashaiman.
Right, Kweku, you're welcome. From Ashaiman, right? What's your question or your concern?
Okay. It's my about whenever time I'm going to check. Then my point is 24.1.
Your sugar is 24.1.
Yeah.
Whenever you go to check.
Yeah.
So that's a long-standing situation.
Yeah.
It's not recent.
No.
Wow. Okay, go ahead. Let's hear your full question.
So I just want to know, because I'm a diabetic or...
So you don't know whether you have diabetes.
Yeah.
So you're talking about your independent measure of your sugar.
Yeah, very good, exactly.
Right. So you have a glucometer and you check, and it is 24 or 21.4. Was it 24.1?
Yeah.
Okay. Chris, I want you to speak to this caller. What do you have to say? He hasn't been diagnosed with diabetes. He checks. He gets 24.1. Even if it was the other unit of measurement, let's relate it in both systems. How would you respond to him?
It's definitely the millimole per liter.
Millimole
yes,
per liter.
I'm sure. You see, the other unit is the American machines.
Yeah.
There are very few in the system.
There are very few.
So most of the time, when somebody 24.1 is really high, like I said,
even if it was 21.4, that's
yes,
high.
it's really high.
It's
really high. So in all probability, you have diabetes. You need to report to the hospital. Let them go through the diagnostic criteria that we talked about and confirm and manage you.
Right. Okay. I hope that's helpful, sir. Okay, he's gone off. So seriously, I mean, there are people who have the gadgets. They are checking. But we are talking about risk and response.
Yes.
So he says this is a long-standing situation, and therefore there's been no response. So there's been uncontrolled, elevated, extremely or severely elevated blood sugar, and we're advising him, by way of response, report and have this. Yeah?
Yeah. In fact, most people are waiting for the symptoms. And that's why I keep on stressing. Fortunately, because of COVID, when we say asymptomatic, people know what we are talking about.
Yeah.
Diabetes by largely does not cause symptoms.
Right.
Especially the type 2.
Okay.
The type 1, because you have no insulin at all, usually you can't go a long time without being diagnosed because you would have symptoms.
I think the gentleman is back on the line. Hello?
Hello?
Yes, sir.
Please, I need the can I have the contact, the doctor number?
Please go to any hospital and report, okay? You can give your number to my producer, but do not wait for a particular number, all right? Every health facility can assist you. If they need to refer you to a higher or more specialized doctor or hospital, they will do that. So don't wait, but Abeku will take your number and we'll see how we can support you, okay?
Sure.
Okay, thank you, okay.
Thank you so much for sharing with us. That's somebody who reports persistently elevated blood sugar. 24 plus or 21 plus is way too high.
It is way too high.
Okay, good afternoon, Joy FM. I have checked my blood sugar level and it's very okay. But floaters, I have quite a lot of. I've been told there's nothing that can be done about it and I have to live with it for the rest of my life. Please, how true is this? This is Mark from Ashongman. All right, I think the gentleman who called was from Ashaiman. But somebody's saying he's getting these visual floaters we just referred to. His blood sugar, he tells us, is very okay. He doesn't give us the score or the indicator.
Okay.
Right? What do you say? He says he's been told the floaters, we are right. It won't worry you. It will be there.
Okay. So when we say a particular symptom about a disease, it doesn't mean it occurs in only that disease. Okay. Right. If you are not diabetic and you are getting floaters, it means that it's not diabetes which is causing that.
Okay.
So you need to see the ophthalmologist for them to determine what else is causing it.
Okay, great stuff. All right, 44 minutes past the hour of 2. That makes it 14:44. Right? WhatsApp is 055 11 997 and our phone line is active 0302 216541. Okay, so are we done with the retinopathy, the diabetic eye disease?
Yes, for now.
Good.
So that we can talk about the others too.
So we shift to diabetic kidney disease.
Yes.
Okay. All right. What's that?
Okay. So diabetic kidney disease. So here you are having an impairment of your kidney function because of long-standing diabetes. Okay.
Right.
And it usually manifests with protein or albumin in the urine. And then your blood pressure may begin to rise. Okay. And then the kidney function drops.
All right.
As measured by our blood tests.
Okay.
Now, here again, too, we want to prevent it. So every year, at least once a year, you check your kidney function, which is a blood test.
Right.
And then you do a urine test, too.
Right.
Because the earlier signs is that there will be protein
and all those
in the urine.
Protein, right. Okay.
But if you wait and you also develop symptoms, here again, too, by and large, you have to lose about 70 to 80% of your kidney function before you begin to get symptoms.
Right.
So we don't want you
by
to
which
wait.
Time?
Yes. You are almost getting
the horse has bolted.
Exactly.
Right.
So here again, too, we are interested in you being screened annually. And if we pick it early, we can halt the progression.
Okie dokie. So this is compromised kidney function.
Yes.
Right?
Yes.
Due to diabetes.
Yes.
Okie dokie. I got this from Dede, Maryland. What about those in diaspora? Are they qualified? Oh, that was last week about the Dede. Me and you, we have our own competition. Okay. If you win, we'll talk. She says, does the dark area around the ankle always mean diabetes? So she's probably talking about some darkening of the skin around the ankle. Reason being, I'd had deep vein thrombosis on vacation when in Ghana some years ago, and that was the beginning of the dark area around my ankle of the leg, where the clot manifest, right? And that was the beginning of venous disorder of varicose veins or post thrombotic syndrome. She's mentioning all of these things,
yes,
but she's still trying to see if there's a possible link between the darkening around her ankle where she had the clot, all right, and diabetes.
Okay, so here again, similar to the person who acts on the float test in the eyes, you know, like I said, a particular symptom is not referable to only one disease.
Right.
Okay, so if you have darkening of the lower limbs, it does not necessarily mean that it is because of peripheral arterial disease.
And particularly because it's in the leg that had the challenge.
Exactly.
All right.
Exactly. Even when you have heart failure and you have swelling of the feet, the red cells move into the tissues. When they break down, they stain the skin black. The DVT is talking about.
Right.
When there's poor venous return, you would have swelling of the legs. The blood would seep into the tissues, break down and darken it. So darkening of the skin of the lower limbs is not synonymous.
She, in her question, actually gives us the culprit.
Exactly.
All right. Unless there's any other indication in the direction of diabetes.
Exactly.
It looks like her doctors, and I know Dede, she's very particular about her annual tests, tests and checks.
Good.
Right.
Dede,
thanks for sharing. Still very, very informative and educative. Right. So it's about 48 minutes past the hour of 2:14:48. Phone line still active, 030-221-6541. WhatsApp is 055-11-11-997. And we're live on Facebook and YouTube. This is Ultimate Health, your ultimate guide to healthy living. With me, Nortey by nature. I'm being schooled at the feet of Dr. Chris Ade, senior physician specialist and senior resident in endocrinology. All right. We're doing diabetes, chronic complications. Okie dokie. So this is to do with the kidney.
Sure.
Do not wait for signs and symptoms to show, because by that time you've lost significant kidney
70
function.
to 80%. You are left with only 20 to 30%.
Whoa.
Yes, so don't wait for symptoms. Don't wait. Yes.
Right. And Doc has emphasized that diabetes alongside hypertension are key drivers of our numbers in end-stage kidney disease, right? Where it's really, really, really bad, okay? We don't want to talk about the number of centers we have for dialysis and all that. We want to make sure you don't get there. That's why we're talking about this. Questions are welcome, 030-221-6541. Ultimate Health on Joy 99.7 FM. WhatsApp is 055-11-11-997. I started very down, but when we are educating, it kind of it lifts you, right? So Chris is lifting me here in the studio, and we're hoping that by virtue of our transmission lines, we are lifting you, informing you, and ultimately transforming you. That's what we do this and every Sunday, 2:05 on Joy 99.7 FM. Okay, so those are the three big ones.
Yes,
right?
With regards to the small vessels, yes.
Small vessels. So we are still on microvascular.
Yes.
You mean there's bigger trouble?
Yes. The large vessel, the one I talked about was the peripheral arterial disease because the person asked a question.
Okay.
The others with regards to the large vessels, the two big boys are strokes and heart attacks.
Strokes and heart attacks.
Strokes and heart attacks.
Secondary or caused by diabetes.
Diabetes, yes.
All right. Share with us, Doc.
So stroke is, in fact, there are two types of stroke, simply put. One in which there is a clot that has blocked a vessel in the brain.
Okay.
And therefore, the part of the brain supplied by that vessel is starved of oxygen and nutrients.
Right.
And then it dies.
Okay.
So that's why we call it an infarctive stroke.
Right.
Then when you have a burst pipe, the blood vessel ruptures. Like sometimes we see around when the pipe has burst.
In the first one, it is blocked.
Yes.
Okay.
By a clot. Like dumping in the gutter.
Right.
We dump things in the gutter and then the rains expose us.
Then the pressure builds behind this.
Exactly.
And then after this blockage, there's starvation, compromised supply of blood.
Exactly.
And then it will affect the related parts of the body.
Exactly.
The second one, not just a block, but
a rupture.
A rupture of a vessel. Now we're talking big vessels.
Yes, now we are talking big vessels.
Right, go ahead, Doc.
So when that happens, we call it a hemorrhagic stroke.
Right.
And you see, like the analogy that I gave, the brain is like the powerhouse in Akosombo. So if there is a shutdown, you know what happens across the whole country.
Right.
Sometimes I think they call it a system collapse.
Okay.
The whole country goes into darkness.
Another way of not saying doom so.
Yes.
Right. Okay. Yeah.
So that is also there, and it occurs when we don't manage you very well or you don't manage yourself very well over the long period of time.
Okay.
Then the analogy is the heart attack, which is what occurs in the heart.
Okay.
So the blood vessels around the heart. You see, the heart supplies blood to the whole body, but it must also supply itself. To live. Okay, so the blood vessels that supply the heart, when they also get blocked, then a part of the heart muscle that is supplied by this blocked vessel would also die. And that is what we call a heart attack.
Okie dokie.
That is what we call a heart attack.
Right. So diabetes can cause this.
Diabetes can cause this.
Right.
Poorly controlled, long-standing diabetes, usually.
Okay. Right. Linda and Osu, her husband says he has a radio, but she owns it. And you dare not change the channel, right? He says, Nortey, please, what do you mean by, or what are floaters in the eyes? I guess she called us later. We'll stick that into the explanation. There's a Mrs. Shrimanting who is asking, what have you done to my mouse and my WhatsApp? It's delayed. Good afternoon, Nortey. Please extend my regards to Dr. Adai. He's my doctor and I like him too much. From Mrs. Chimanting. Hey, Madam, Shaye pa.
I know her very well.
And they Sunday, Nanka. Okay, right? So that's Mrs. Chimanting. If this was Parliament and it was Katie Hammond, Dr. Adai would say, Mummy fans. Another caller on the line. Let me just read this. Okay, let me take the caller. Hello, good afternoon.
Afternoon,
I'm fine. Hey, Ajingo the man.
Yes, I was.
Yes, I finally met him on Saturday as well. He's smaller than his questions. Please fire away.
Yeah, please forgive me if you have touched on it because I didn't start from the beginning.
Okay.
I want to know if they say it is maybe it's a hereditary. I mean, how does it work? And also, I mean, all you say it comes from sugar. Does it mean eating this raw sugar in our food are the causes, or if let's say our eating habits, some kind of food that we eat also contribute to it?
Well,
and the lifestyle, that exercise and other activities.
You are 3 weeks late, Ajingo. Abek will give you a plot to weed. We've done all these things, but we'll see how best Doc can, because we started this before the 14th of November, right? But he will answer then. So he's asking diet, is it the sugar content, as in sugar as we know it, and so on and so forth, right? And then he's asking about lifestyle as well. Okie dokie. So we've taken the love from Mrs. Tremanting, and Doc has gladly received it. Mrs. Adai, it wasn't me, but coming back. So So the heart can be affected by diabetes.
Yes.
And the brain and its vessels, because a stroke actually is a brain event.
Yes.
Right? Either there's a blockage in a vessel or there's a burst vessel.
Yes.
Okay. Any more we need to know about these macrovascular complications?
Okay, so there's something we also call, apart from the heart attack, you can also have heart failure. Okay, here again too, the vessels are damaged. In fact, a heart attack can lead to heart failure.
Right.
But even in the absence of a heart attack, the small vessels within the heart can also be damaged such that the pumping activity of the heart is compromised.
Right.
And it leads to heart failure.
Okay.
So heart failure can also occur as a result of diabetes.
Doc, so if you have diabetes, you should be checking everything.
You should, honestly.
On a regular basis.
You know what I tell my patients? Almost everybody has a car.
Right.
So I tell them that, you see, in Ghana, some people pride themselves in the fact that I am 62 years old and have never been to the hospital. And I say this is not something to be proud of, okay? Because in civilized societies, they will send you reminders to come for annual checkups.
Right.
And then I ask them, do you have a car? He says yes. Do you go for checkups? Oh, yes, every 3 to 6 months. And my question is, your car and then your body, which one is more important?
And which one has spare parts?
Exactly. So if you go to do preventive maintenance of your car, your body is even more important.
So, Doc, what you are saying is this is not a cost, it's an investment.
Exactly.
You are investing in your health and your well-being.
Exactly.
And you refuse to do that.
If you don't take care of your health, you would have to spend all your money in future to deal with only the complications.
Whoa.
You know, you need to take care of your health now, prevent the complications so you can enjoy your life.
Good stuff. All right, you're hearing all this on Joy 99.7 FM. We're dealing with diabetic complications. Anytime I feel we're wrapping up, then I realize there's so much we need to deliver to you, our discerning listeners. And thank you so much for tuning in this and every Sunday. Ever since, we outdoored this, was it 2003, right? Yeah. We're still doing it. Okay. So the fact that you're calling in, you're connected through different means. Now we're digital. I didn't bring it to. I beg you. We're digital, but it means that we're doing something right, and we appreciate you for appreciating us. Okay. So, Doc, we need to be checking all these body systems because blood goes everywhere.
We need to.
Right?
We need to.
And if our blood, in terms of sugar level, is compromised, then that damage or that potential damage goes everywhere.
Yes.
Okay.
Yes.
Right. So we've talked about erectile challenges with men. We've talked about nerve problems. We've talked about eye-related issues. We've talked about the kidney. We've talked about the heart. We've talked about strokes. Is there anything that is hiding somewhere that may not be, should I say, in the top 5 of the league table, but it's still a complication?
Okay, I don't want to leave our pregnant women out.
Yeah.
There is something we call transgenerational effects.
Okay.
Or epigenetic effects. Where if a woman has diabetes, whether the diabetes was there before the pregnancy or she developed the diabetes whilst pregnant, what we call the gestational diabetes, and she is not properly managed, she can put the unborn baby at risk in future for conditions like diabetes itself, obesity, hypertension, kidney disease, among others.
Okay.
So you see that it's a transgenerational effect. So this baby will be born to a mother who had diabetes that was not properly controlled. Okay. And that has already set the tone for when she becomes 20 years or 25 or 30 years.
Okay.
So we need to deal with all these conditions.
Okay.
When even you are pregnant.
Alrighty. Ajingo asked something about familial, factors or genetic factors. Can you say that in a quick sentence?
Okay. So
can you inherit this?
Okay, so we don't inherit it directly. Okay, when we talk about type 2 diabetes and we talk about the genetics and environment, we are talking about risk. We are not talking about direct heritability.
Okay.
So if your mom or your dad has diabetes,
your risk.
It increases your risk. Not that by all means you'll be born with it.
Quickly, Dede sticks this one in. Is stroke and aneurysm, are they one and the same thing? Aneurysm and stroke.
Okay, so aneurysm simply means you have a focal dilatation within a particular segment of the blood vessel. So
like a bulge,
a balloon, so it has ballooned out, and that part is weak.
Right.
So it can rupture.
Okay.
So that is what an aneurysm is.
So an aneurysm would be at risk.
Exactly. If this vessel is in your brain,
okay,
and it ruptures,
okay,
of course that is a stroke.
Okay.
But if it is in any other part, then depending on the function of that organ,
right,
you will suffer the
great stuff. So with all of these complications and with all we said, Doc, our time is up. But it does seem to underscore the need to be under proper skilled professional management. This is not something you'll be popping in and out of the pharmacy buying things for.
Exactly.
There's a lot of management, monitoring, evaluation involved. And from what we've learned about the different symptoms or systems that can be complicated or compromised by diabetes, a lot of related specialists are also involved. Should people be, should I say, managing this themselves once they've got the diagnosis?
Not at all. Not at all. You should be properly managed. You know, let me go back to Akusumo again. Maybe I love the powerhouse because I used to work with
VRA. Yeah, I know where it's coming from.
You see, there's something they call planned or preventive maintenance.
Right.
Okay. They do not wait for things to break down before they fix them.
Okay.
Otherwise, it will be more costly, and then the whole country we would be in darkness for quite some time before they get that part. Okay. So if a part is supposed to last for, let's say, 3 or 4 years, they would change it when it is 3 or 4 years.
Right.
They wouldn't say let's go 1 or 2 years because it hasn't broken down. They will change it. So in the same vein,
right,
you don't have to wait for these complications to occur. You don't. People are asking for symptoms.
Yeah.
Don't wait to get the symptoms.
Okay.
You know, be managed by a qualified professional. We would be checking these things as and when necessary. You know, every year we check your kidneys.
Right.
Every year you see the eye doctor, you see the dentist. You know, we look at the urine, we check your cholesterol, the blood pressure, all the others.
All right.
You know, so please check yourself in. Yes.
Yeah. Know your
check yourself in, and then be appropriately managed.
Okay. And of course, the doctors, the qualified doctors like Dr. Chris Adai, cannot do it without your cooperation. Okay, so those of you in the stubborn academy, or you go small, then you dodge him for maybe 6 months, 8 months, thinking you've saved money, right? This is the tail of the tape. This is serious business, and diabetes and its, should I say, co-conspirators affect too many families in this country for us not to talk about it. That's why for the past 4, have we done 4 weeks? Yeah, I think we've done 4 weeks.
Yeah, it's last week we didn't come
last week. Apologies because of the Habitat Fair, but we're sure you got the benefits of that.
Yes.
For the past 4 weeks, since the middle of November, we've had Chris. I am giving him a little break. But maybe we need to come back sometime soon to talk about this and probably talk about the misinformation out there, which is also damaging people. We try and do our best to diligently give you the best up-to-date information. Chris, many thanks. We are deeply indebted to you and your colleagues, but we'll come back to this as well. You've made it so simple for us. Thank you so much.
You're welcome. Always a pleasure.
Right. Thank you, Abeku, Sankofi, my discerning listeners, whether you were at, what's the name of the hotel again? Hotel de Cheche, or, whether you want a trip to Dubai or not. Me and Abeku, we can take you to Kaswa. And there's a joint there. Okay, you don't need a passport or a Ghana card, right? Many thanks for sticking and staying with us on Joy 99.7 FM. My name is Nortey by nature. You've also lifted me, yeah. So I'm in a good, better mood despite my loss. Stick and stay on Joy 99.7 FM. I'm out.
Go for gold.